Welcome to our presentation on effective listening. Contrary to popular belief, there are many dimensions of listening that apply to an individual at any given time. Effective listening is an acquired skill that one may learn through practice, keen attention, and professional development. It is extremely important to gain substantial listening skills for use in the medical field, as health professionals are constantly bombarded with information from patients, clients, and managers. People tend to have poor listening skills and are usually unable to properly uphold proper listening cues that may be present in any given conversation. During conversation, there are cues that one may express to inform the sender that the individual is listening. But some of these cues may actually hinder the effectiveness of the message being sent. As we progress through life, we tend to pick up bad habits that hinder our listening ability. These habits reduce the effective listening that one can do. Some of these negative habits consist of saying yeah, hearing only selected parts of a message, taking statements made personally, and revolving the conversation around oneself. With pseudo listening, saying things such as yeah or uh-huh at specific intervals tend to give a sense of disinterest within a conversation. These words are unprofessional and mostly used in a casual setting. Selective listening creates an incomplete and often assumed understanding of the situation because not enough information has been absorbed by the conversation. As one chooses what they want to hear, other pieces of important information may be dismissed in its entirety, creating gaps of the conveyed meaning. Defensive listening closes the listener into a protective barrier that hinders one's understanding of what is being stated. Because the comments are being viewed as directly negative to the individual, the meaning being conveyed by the message may be disregarded due to irrational emotion. Stage hogging cuts off the sender and the message being sent to satisfy the listener's desire to speak. The conversation becomes egocentric, only revolving around the listening individual. This etiquette is viewed as rude and is typically shamed. As with any learned skill, there are always barriers that affect the quality. There are many common reasons why one may experience ineffective listening. The most common is the listener simply cannot hear the message. A common misconception of fixing this problem is to repeat the sentence louder. This, however, does not necessarily work, as a problem tends to lie within the audible pathways used to convey the message. A way to fix such problem is to reword the sentence. Another barrier to listening is active thought. If the listener is engaged in many different thoughts, it becomes more difficult to effectively listen to the message being sent. Multitasking is generally difficult to accomplish, and listening while doing another task is no different. Perceived distractions is a barrier that listeners may face. Things such as physical and visual distractions divide the attention of the listener, making it increasingly difficult to adequately listen. When a message becomes too long, it too can become a barrier to listening. Providing too much redundant detail can also distract the listener, as they are oversaturated with enough information that they need to understand the conveyed meaning.
What do you do when your doctor just doesn't seem to listen? Well, you need to take control of your own health. And here with some advice is Rabbi Ed Weinsberg, who's written a book about prostate cancer and getting the most from your physician. Thank you so much for coming in.
My pleasure.
Why sometimes do patients find that doctors just aren't listening?
Doctors often don't listen because they're on overload, they're on a treadmill. The healthcare system leaves many of them underpaid, to the surprise of many patients. Some simply don't know how to balance their terrific skills with certain listening skills. Being a surgeon or other kind of physician requires a certain human touch.
Do doctors just not care in some cases? Are they just patient machines?
I think most doctors really care, but they don't have all the empathy that the patients seek. And they don't listen to what Theodore Reich called with a third ear, that inner ear that's kind of comprehending what patients really are asking behind their questions.
So, how does one listen better? There are numerous ways that one can increase their skill. Paraphrasing is a good way to indicate to the sender that you understand what they are saying. By reworking the individual words, which is called parroting, the speaking individual gains a sense of confidence that they are being heard. It also gives the speaking individual the opportunity to correct any thought that was incorrectly perceived by the listener to ensure the message is properly decoded. Prompting offers such benefits Prompting also offers such benefits as the listener provides relevant information and encouragement about the topic at hand. It indicates that the listener is knowledgeable of what is being said and meant, is displaying an unbiased attitude about what has been spoken, and shows a genuine care with the speaking individual. Asking questions ensures that the listener is trying to understand the speaker. Questions are used to cover the gaps in knowledge, recap areas of difficult understanding, and to reaffirm the speaker that there is interest within the conversation. Using a combination of open-ended and closed-ended questions creates variability and dynamic during the conversation.